Hello everyone, my name is Dr. Gaston Sakbono. I'm from Benin in West Africa. I'm a dental surgeon and a public health researcher with a special interest in epidemiology and oral health. On behalf of my co-author, Professor Benedicta Ngwechi Nkechugag from University Walter Sisulu in South Africa and myself, I'm pleased to briefly present our study. The study is entitled Prevalence and Determinant of Dental Anxiety Among Adults in Benin, an analytical cross-sectional study at the Health Center in Parakou 2025. This was an analytical cross-sectional pilot study conducted at the dental clinic of the Medical and Social Center of the Parakou Garrison in northern Benin. The idea for this study came from daily dental practice. Some patients come to the dental clinic tense, scared, or intimidated by the devices. This anxiety can sometimes lead patients to delay dental care until their oral health deteriorates to concerning levels. Before this study, there was no published local evidence from Benin on dental anxiety among adult patients. That is why, as a research team, we considered this pilot study important. The study recruited 120 adult patients who attended the dental clinic and gave written informed consent to participate. Dental anxiety was assessed before care using the dental fear survey, which is a recognized questionnaire. We also measure heart rate before and during dental procedure using a chest warm polar H10 sensor. This allowed us to compare the patient's reported anxiety with a physiological indicator of stress. The objective was to estimate the level of dental anxiety, identify associated factors, and observe how the body reacts during dental procedures. Our results showed that dental anxiety was generally low in this pilot sample. The mean dental fear survey score was about 34. 81% of participants had low anxiety, while 19% had moderate anxiety. We did not observe severe dental anxiety in this sample. However, the proportion of patients with moderate anxiety was clinically important. Even moderate anxiety can influence the patient's experience, acceptance of care, and willingness to return follow-up. The main anxiety triggers reported by patients were pain and local anesthetic injection. Pain related to dental procedures was reported by 30% of participants and local anesthetic injection by 17.5%. In the adjusted analysis, femoral cells and higher educational level were independently associated with dental anxiety. The association with education should be interpreted with caution because many participants in this study had university level education. We also found that heart rate increased more during dental extraction than during consultation or scaling. This suggests that dental extraction is a particularly stressful procedure and requires better communication, preparation, and reassurance. These findings have practical implications. First, dental teams should identify and ensure patients before care, especially when an invasive procedure is planned. Second, dentists should clearly explain the procedure, why it is necessary, and how pain will be managed. Third, pain prevention and pain control should remain central in dental practice. Well explained and carefully administered local anesthesia can help reduce fear and improve patient confidence. Finally, insured patients may benefit from calm communication, step-by-step explanation, short breaks, briefing exercises, and a clear signal to stop the procedure if needed. In conclusion, this pilot study from Benin showed that dental anxiety was generally low among adult patients, but moderate anxiety affected nearly 1 in 5 participants, with pain, injection, sex, educational level, and dental extraction playing important roles. The key message is simple. We should listen to patients, anticipate pain, explain procedures clearly and pay special attention to invasive procedures such as dental extraction. Improving the emotional experience of dental care can strengthen trust, improve adherence to treatment, and contribute to better oral health outcomes. Thank you.